Imagine a world where cities fall silent, markets close, families stay locked inside their homes, and an invisible enemy spreads from person to person. Throughout history, humanity has fought wars, built empires, and explored space, yet our greatest threat has often been something too small to see: viruses and bacteria. Pandemics have killed hundreds of millions of people, changed governments, collapsed economies, and reshaped civilization itself. This is the story of the deadliest global pandemics ever recorded, and how each one changed humanity forever. Number 1. The Plague of Justinian, 541 to 750 CE. The first recorded global pandemic began during the Byzantine Empire under Emperor Justinian. Historians believe the disease started in Egypt before spreading through trade ships carrying grain, along with infected rats and fleas. Soon, the capital city, Constantinople, faced catastrophe. Historical accounts describe thousands dying every day, streets filled with bodies faster than they could be buried. Symptoms included fever, delirium, and painful swelling known as buboes. At its peak, nearly half the population of affected regions may have died. The empire's economy collapsed, armies weakened, and expansion plans failed. Many historians believe this pandemic permanently altered European and Middle Eastern history. Number 2. The Black Death, 1346 to 1353. 8 centuries later, the same bacteria returned, stronger and deadlier. The Black Death traveled along Silk Road trade routes from Asia into Europe. Within years, cities across Europe experienced unimaginable loss. People developed blackened skin patches caused by internal bleeding, giving the pandemic its terrifying name. Entire villages vanished. Fear spread faster than the disease itself. Many believed the apocalypse had arrived. Between 75 and 200 million people died worldwide. But surprisingly, the pandemic reshaped society in unexpected ways. Labor shortages gave workers bargaining power, feudal systems weakened, wages increased, and social mobility slowly improved. A tragedy unintentionally accelerated modernization. Number 3. Smallpox, humanity's ancient killer. Unlike sudden outbreaks, smallpox haunted humanity for thousands of years. Caused by the variola virus, it spread easily through breathing or physical contact. Victims developed high fever, followed by painful fluid-filled blisters covering the body. Many died. Survivors were often left blind or permanently scarred. When European explorers reached the Americas, smallpox devastated indigenous populations lacking immunity. Entire civilizations collapsed before battles even began. Over centuries, smallpox killed more than 300 million people. Humanity's victory came through vaccination, pioneered by Edward Jenner in the 18th century. In 1980, after a massive global effort, smallpox became the first disease ever eradicated. A rare moment where humanity truly defeated a pandemic. Number 4. Cholera pandemics, 1817 to present. Cholera introduced a terrifying reality: disease could spread through water. Originating near the Ganges River, cholera expanded globally through trade and urban growth. Victims suffered severe dehydration caused by continuous vomiting and diarrhea. Death could occur within hours. Cities realized overcrowding and poor sanitation were deadly. Scientists eventually discovered contaminated drinking water as the cause. This discovery revolutionized urban planning. Modern sewage systems, water treatment plants, and hygiene practices were born because of cholera pandemics. In many ways, modern public health exists because humanity learned from this crisis. Number 5. Spanish flu, 1918 to 1920. Near the end of World War I, soldiers returning home unknowingly carried a new influenza virus. The Spanish flu spread rapidly across continents. Unlike typical flu outbreaks, it killed young and healthy adults. Many victims died when their immune systems overreacted, flooding lungs with fluid. Hospitals overflowed. Masks became mandatory in many cities. Public gatherings were banned, scenes familiar even today. Around 1/3 of humanity became infected. At least 50 million people died worldwide. The pandemic forced governments to improve disease tracking and international cooperation.
6. Asian flu, 1957 to 1958. By the mid-20th century, globalization accelerated disease transmission. The Asian flu emerged when bird and human influenza viruses combined genetically. Air travel allowed the virus to circle the globe in months instead of years. Scientists rapidly developed vaccines, one of the earliest examples of coordinated global medical response. Despite advances, about 1 to 2 million people died. Humanity had entered the age of modern pandemics. 7. Hong Kong flu, 1968 to 1970. Only a decade later, influenza evolved again. The Hong Kong flu demonstrated how viruses constantly mutate to survive. Though less deadly, global connectivity enabled rapid spread. Approximately 1 million deaths occurred worldwide. The lesson became clear. Pandemics were no longer rare historical events, they were recurring biological challenges. 8. HIV/AIDS pandemic, 1981 to present. HIV introduced a different kind of pandemic. Instead of spreading through air, it transmitted through blood in bodily fluids. The virus attacks immune cells, slowly destroying the body's ability to fight infections. Early misunderstanding caused fear and stigma worldwide. Millions died before treatments existed. Today, antiviral therapies allow infected individuals to live long lives. Still, more than 40 million people have died since its discovery. HIV reshaped medical ethics, awareness campaigns, and global healthcare cooperation. Number 9. SARS outbreak, 2002 to 2004. SARS marked the warning sign of future coronavirus pandemics. Originating from animal markets, the virus spread through respiratory droplets. Though infection numbers remained limited, its high fatality rate alarmed the world. Aggressive quarantines, airport screening, and rapid isolation stopped transmission. For the first time, global coordination successfully prevented a pandemic-scale disaster, but it also revealed how quickly new diseases could emerge. 10. H1N1 swine flu pandemic, 2009. The H1N1 virus formed through genetic mixing between pig, bird, and human influenza strains. Within weeks, infections appeared worldwide. Fortunately, many cases were mild compared to earlier pandemics. Still, hundreds of thousands died globally. The event tested modern pandemic preparedness systems and accelerated vaccine production technology. 11. Ebola global outbreak, 2014 to 2016. Ebola caused one of the deadliest known viral diseases. Symptoms included fever, organ failure, and internal bleeding. Mortality rates sometimes exceeded 50%. The largest outbreak struck West Africa, overwhelming healthcare systems. Though geographically limited, fear spread globally. International medical teams eventually contained the outbreak through isolation and protective equipment. Ebola demonstrated how local outbreaks can become global threats without rapid response. 12. COVID-19 pandemic, 2019 to present. In late 2019, a new coronavirus emerged. Within months, COVID-19 spread across nearly every country on Earth. Governments imposed lockdowns, schools closed, flights stopped, and billions stayed indoors. Healthcare systems faced enormous pressure. The pandemic reshaped work culture, accelerating remote jobs, online education, and digital communication. Scientists developed vaccines at unprecedented speed. COVID-19 became the most disruptive global event of the modern era, causing millions of deaths and lasting economic impact.